So our most recent question was with regards to surgery and the possible complications that can occur from surgery. Well, as every surgery is a little different and can be done different ways, there are some general surgical complications that would be very important for us to talk about. Number one is there's always the possibility for recurrence. There is not a 100% guarantee with surgery in general. Any surgeon that would tell you that, run. The second is that there's a possibility for scarring. There's a possibility for just general pain. What we try to, if a patient's pain is out of control, they just can't take it anymore, they cry an uncle, or is keeping them from doing what they want to do, that's when we talk about doing surgery. And the hope then is that we're giving them a percentage of improvement with pain. If all the pain goes away, excellent. But usually we're just trying to help to ameliorate the significant symptoms that they're having that's preventing them from having a normal lifestyle. There is a fourth very common one, and that is swelling. And what we're dealing with the feet is the gravity. You know, there's just a lot of distance between your heart and the foot, and you can have swelling in your foot after surgery for up to a year afterwards. Up to a year. It could be even more. It could be usually it's less, but it's up to a year. There are some other more complicated, more painful, in-depth complications that can occur, I guess, with surgery. One of those could be a deep vein thrombosis, where somebody can develop a clot in their leg that can then travel, and there's a potential for it to get lodged in the lungs, and that can be fatal. There's also something called complex regional pain syndrome. And both of those are in less than 1% of patients, but it's something still to be aware of. Complex regional pain syndrome is where it's just a chronic pain syndrome that you have now that could last for years, and it may never go away. In fact, it could even start traveling and going to other limbs as well. So there are some things and steps that we take that, with communication between the surgeon and you, we can help to prevent a lot of these things from occurring. But absolutely, communication is the key. So there are, if you have specific comorbidities, things like diabetes, or if you smoke, those also have their own other sets of complications that can contribute to a negative result afterwards. And so I hope this has been helpful. I would recommend, if you have questions about surgery and your specific scenario, that you contact our office, and we'd be happy, one of the surgeons here at Pueblo Foot Care, to discuss your unique situation.